Part 3. During this session, we will continue to pursue areas of concern which could be factors in any juvenile court proceeding. The first set of topics will focus on the safety of the child and becoming familiar with how to recognize domestic violence. Let's start by examining the safety decision process. Making decisions regarding the safety of a child requires a methodical, logical, and thorough process. You should know the extent of maltreatment, circumstances surrounding the maltreatment, the child's vulnerabilities and strengths, the attitudes and behavior of the parents, and how the parents care for and discipline the child in order to make appropriate recommendations at the multidisciplinary team meeting and during court. There are 3 factors that must be considered when determining whether children are unsafe. First, whether threats of danger exist within the family. Second, whether children are vulnerable to such threats. And third, whether the parents have insufficient protective capacities to manage or control those threats. Determining whether these 3 criteria are present is based on an independent analysis of information observed or gathered from reliable sources. The answers to these 6 questions will help you in the court determine whether a child is unsafe. What is the nature and extent of the maltreatment? What circumstances accompany the maltreatment? How does the child function day to day? How does the parent discipline the child? What are the overall parenting practices? How does the parent manage his or her own life? The answers to these questions also help you to decide on the actions and recommendations that are necessary for the children's safety. In addition to the answers to these 6 questions, you must work with the DFS worker in the court to determine if there are any specific threats of danger present. There are also a number of characteristics a vulnerable child may demonstrate. Children who are young in age or who have developmental disabilities are considered especially vulnerable. In order to determine whether a parent has sufficient protective capacities, you must work with the DFS worker to determine a parent's cognitive, behavioral, and emotional strengths. A parent, in part, demonstrates a cognitive protective strength when he or she has a plan to protect the child. A behavioral protective capacity is demonstrated, for example, when a parent exhibits impulse control. Finally, emotional protective capacity can be shown when a parent has a strong bond with the child. Be sure you are discussing these issues, concerns, and questions with the DFS worker and parents or caregivers. A safety plan is put in place when a child is unsafe, based on the presence of the 3 criteria discussed earlier. In this situation, the DFS worker decides what actions and tasks will enhance the parent's capacity to control threats to the children in the least intrusive manner. This is referred to as a safety plan. Safety plans do not state how the parent should change. Instead, safety plans provide a plan for how to immediately control any dangers to the child. Because safety plans require immediate control of dangers, they may allow for 100% in-home care, 100% out-of-home care, or a combination of both. You should have a copy of the safety plan that the worker and family create and ensure it addresses any safety concerns you have. In some cases, you may be asked to participate in the development of a safety plan for your client. As a GAL, you should advocate for the development of safety plans. The existence and implementation of a safety plan can prevent removal of a child from their home and can expedite your client's return to his home. It is important to note that safety plans are not the same as case plans. Case plans describe services and rehabilitation the family needs to be successful. The effect of a case plan may also occur over time, whereas safety plans are in place to mitigate immediate threats. Federal and state laws stipulate what must be included in a case plan. Case plans must specify a strategy for addressing the reasons the court became involved. Progress towards case plan goals is measured in behavioral, emotional, and mental health changes. Case plans should be reviewed at each court hearing, as well as in between hearings, but no less frequently than every 6 months. If necessary, case plans can be revised to ensure adherence to federal safety requirements, as well as outline a logical process for safety decision-making and goals that will lead to success. GAL should always request and obtain a copy of the DFS case plan and should ensure it contains all necessary goals and services that you believe are in the child's best interests. The decision to reunite children with their parents is often a difficult one. For this reason, a methodical decision-making process is important for determining whether a child is unsafe. You need to ensure the decision is based on objective data rather than subjective emotions. Case plan progress should be reviewed frequently and will inform the reunification decision. Review of your client's case plan should occur continuously, not just at court review hearings. If an in-home safety plan was previously deemed insufficient, you and the team should consider a number of factors to determine whether reunification can occur, including the status of threats of danger and any new threats, the parent's willingness and capacity to support in-home reunification, DFS recommendations, and the reunification plan. Note that this is not a complete list of the considerations that the team must make. All of these factors are assessed to ensure that reunification does not occur without significant planning and preparation. When an in-home safety plan is sufficient to eliminate any threats to the child, reunification should occur. Remember that the goal of any juvenile court proceeding is reunification with the family, unless it is not safe for the child. In order for the case to be dismissed, the case plan should indicate the supports, services, and habilitation the family need for the child to fully be safe. As stated earlier, as opposed to the safety plan, the case plan provides a more long-term course of goals to reduce specific threats of danger and to increase the parent's protective capacities. The court should dismiss the case when there is sufficient information to support that there are no imminent threats of danger to the child, that parents have protective capacities, or both. In order for a GAL to fully understand child safety, there are a few specific topics that need to be further understood. The first topic is domestic violence, which includes understanding the dynamics of domestic violence, realizing that co-occurrence of child abuse and domestic violence is common, screening for potential domestic violence, and knowing the guiding principles to ensure safety in domestic violence cases. Clinical observations form the primary basis for current beliefs and understanding about the dynamics of domestic violence. Adequate legal representation requires you to understand contemporary views of child abuse and domestic violence dynamics and have the ability to ask informed questions throughout the process. Domestic violence in the home in which a child lives has long-lasting effects on children. Witnessing this violence against a parent can be traumatic, although all children are affected differently. The impact to the child depends on the severity and frequency of the abuse and other supports available to children. You, as the GAL, need to know if this is occurring in the home. It is also important as you deal with visitation and other aspects of co-parenting between the parents of your client, as you could be putting one parent at risk of harm or even death. Yet on the other hand, you should not make the assumption that the child should be taken out of the home immediately just because of domestic violence. It is difficult to gather statistics on child maltreatment and domestic violence because many women are reluctant to discuss or report abuse in the home. Nationwide, domestic violence may be the single major precursor to child maltreatment and neglect. Instances of child abuse in homes where domestic violence is present occur at much higher rates than with other children. It is critical to protect an abused parent as means of protecting the child, as it significantly reduces the risk of the child becoming an abuser himself. Many risk factors may occur simultaneously and place children at a greater threat for maltreatment. There is growing evidence that various forms of maltreatment on children tend to co-occur. Types of overlapping co-occurrence abuse often include sexual, physical, psychological, and witnessing violence. It is important to keep the co-occurrence risk in mind when completing a domestic violence screening or evaluating threats of danger in the child's home. It is important to remember that in many homes where child abuse occurs, domestic violence against a parent, oftentimes the mother, is also occurring. The sad facts are that 50% of men who frequently assaulted their wives also abused their children. Men who abuse their partner seek sole physical custody of their children 2 times more often than nonviolent men. Perpetrators of domestic violence who were abused as children are more likely to physically harm their children. Battered women are half as likely as men to abuse their children. And witnessing violence may put children at risk for aggressive, antisocial, or fearful behavior. Domestic violence screening is used to help determine whether a person may be involved in an abusive relationship that needs attention. When possible, you should address the following questions with the referring agency or the individual involved about domestic violence. Has anyone else in the family been hurt or assaulted? If so, describe the assault or harm. Who is the victim? Who is the perpetrator? Is anyone using economic coercion or emotional abuse to control another family member? Are drugs or alcohol present? Have there been any threats of suicide or detailed threats to cause harm to a family member? Has anyone in the family made threats to hurt or kill another family member or himself? If so, describe what happened. Who is the intended victim? Who is the perpetrator? Do you know if weapons have been used to threaten or to harm a family member? What kind of weapons? Are the weapons still present? Have the police ever been called to the house to stop assaults against adults or children? Have arrests ever been made? Has anyone threatened to take the children? Has any family member stalked another family member? Has anyone ever taken a family member hostage? Do you know who is currently protecting the child? It is important to remain calm and convey that these are routine questions asked in all cases. When responses are vague or confusing, ask additional clarifying questions to ensure a clear understanding of the facts. Victim survival strategies are often overlooked, and instead the victims may be blamed for allowing the children to be abused. You need to understand that abusers undermine the parental authority of the victim, which can lead children to have less respect for the victim because they see her as weak. You should be aware of both circumstances that present harm to the child and possibilities for reducing that risk to a safe level. A threat of danger is any specific family situation or behavior, or it could be an emotion, a motive, a perception, or capacity of a family member that is specific and observable, out of control, immediate, or imminent, and has severe consequences. When you are presented with such a situation involving one of your clients, there are 6 background questions that should guide your safety decisions. What is the nature and extent of the maltreatment? What circumstances accompany the maltreatment? How does the child function day to day? How does the parent discipline the child? What are the overall parenting practices? How does the parent manage his or her own life? By collecting answers to the 6 safety questions, you and the court should learn which threats of danger are present. Identifying domestic violence is critical to the safety of children. It is important to remember community resources for victim safety and perpetrator accountability, including victim advocacy and support services, schools, DFS staff, and effective criminal justice response to domestic violence. Advocates are an especially valuable resource to keep both the adult victim and the child protected from violence. Oftentimes, the best way to keep the children safe is to keep them safely with a non-offending parent. Long-term consequences of child abuse and maltreatment can be profound and may endure long after the abuse or neglect occurs. Trauma effects can appear in childhood, and they may affect various aspects of the child's development, including physical, cognitive, psychological, and behavioral. These effects range in consequence from minor physical injuries, low self-esteem, attention disorders, and poor peer relations to severe brain damage, violent behavior, and death. While maltreated children pose a greater risk for these negative effects, many children are resilient in the face of adversity. Battered child syndrome is an accepted medical diagnosis and is used when a child has sustained repeated and/or serious injuries by non-accidental means. Battered child syndrome may occur at any age. However, the majority of affected children are younger than 3 years. In some instances, the clinical manifestations are limited to those resulting from a single episode of trauma, but more often, the child's general health is below normal, and they show evidence of neglect, including poor skin hygiene, multiple soft tissue injuries, and malnutrition. GALs must become familiar with the domestic violence screening process and the warning signs to look for, which may indicate possible abuse. Take the time to understand the symptoms and impacts of repeated or serious injury resulting from abuse.